Hi, I'm Congresswoman Karen Bass. I represent the 37th District in Los Angeles. And for many years before I ever dreamed of becoming a member of Congress, I worked in the healthcare field. First, I worked as a nurse, and I worked in the neonatal intensive care unit for many years. And then I became a physician assistant, and I worked in Los Angeles County's emergency room at LA County Hospital in the trauma center. And for years, I saw numerous people who would come to county because they didn't have health insurance. And I can't tell you how many people I saw, unfortunately, at the end of their life. And I saw them at the end of their life because whatever they had, whether it was cancer or heart disease, they went without medical care for so many years. And then when they got so sick that they just couldn't cope anymore, they came to County Hospital. Unfortunately, many times it was too late, and they only had a few months to live. When the Affordable Care Act was passed several years ago, I understood very specifically how it would save people's lives. And one of the most important parts of the Affordable Care Act was pre-existing conditions. And so before, if you had diabetes or high blood pressure, an insurance company could say, you know what, you have a disease, we're not going to pay for you. Well, the truth of the matter is that almost everybody, after you hit a certain age, 60, 50 years old, pretty much everybody has a pre-existing condition, whether it's arthritis or high blood pressure or high cholesterol. And the fact that the Affordable Care Act required insurance companies to cover you and they couldn't discriminate, whether you had employer-based insurance or whether you didn't have insurance at all, the Affordable Care Act has really contributed to improving the health of our country. And so now the idea that my colleagues on the other side of the aisle want to take that away, and they do it under the guise of, we want to lower premiums. But the fact of the matter is that I could have health insurance and I only paid $10 for it. Well, what do you think it's going to cover? Some of you might remember the days when many of us had health care policies only to get sick and find out that our health insurance didn't cover anything. That's the whole point of the essential health benefits that the Republicans are trying to take away. The Affordable Care Act required insurance companies to cover a list of essential benefits such as maternity care, emergency room visits, pediatric care, a lot of tests, prevention tests like colonoscopies and mammograms. A lot of us who've had health care with our employers might not have even realized that we were benefiting from Obamacare. We were benefiting from the Affordable Care Act. Some people think that the Affordable Care Act just helped people that didn't have insurance. The Affordable Care Act actually helped all of us. And so a couple of my constituents, Amanda from Culver City, she sent me a note and she said that I live with lupus and other chronic autoimmune conditions. My health impacts every single day of my life. And the Affordable Care Act has allowed lupus patients like me to be able to afford our doctor appointments, lab works, and medication. Please help all of us with pre-existing conditions. If the Republican plan goes through and you currently have some type of health disorder, understand that you can easily be dropped from your insurance plan. Patrice from Palms, she said that she's very worried and concerned, not just for herself, but for everyone sharing my circumstances. She said she was hit by a hit-and-run driver in 2015, and without her Medicare, she would have surely lost her home because the treatment of her injuries to date has exceeded $100,000. One of the things that the Republicans always say is that with their so-called plan, people can have health savings accounts. Will you tell me how many of you could have $100,000 in a health savings account? Most of us have difficulty having a savings account, period. Well, if you have $10 or $15 or $20,000 in a savings account and you have more than a cold and you go to an emergency room, you can run through that health savings account in the matter of 1 or 2 visits. And so we all have to fight to make sure that the Republicans are not going to be able to go through with their plan. I call it Trump care. I call it Republican care, because you know what? If they make these changes, then everything is on them. All of us agree that there are things that we need to do to improve the Affordable Care Act, but since the Republicans had a position of repeal, we couldn't even have a conversation about improving. No piece of legislation, be it Social Security or Medicare or Medicaid, you do in one fell swoop. So the Affordable Care Act, we probably could spend 5 to 10 years improving it, but because the Republicans have had a position of repeal, they haven't even allowed us to make any of the improvements that all of us know need to be made. So I would just encourage everyone watching, make sure you stay in contact with senators. They don't even have to be from your state, because we don't have to worry about our senators, Harris and Feinstein, but call the other state. All of us have friends and family around the country. Make sure you call them and make sure you tell them it is unconscionable for the richest country on the planet in the history of the world to literally take health care away from its population. Thank you. Congresswoman Karen Bass, District 37, Los Angeles, California.